1 in 3 high school students reported their mental health was not good during the past 30 days. That's according to the CDC. During National Children's Mental Health Awareness Day, Dr. Charlotta Dennis with Priority Health is here to talk about this data and what parents can do to support their children. Dr. Dennis, thank you so much for being here with us.
Yes, thanks for having me.
So, as I just mentioned, the CDC says 1 in 3 high school students reported poor mental health in the past month. Just talk about what's behind this rise.
We see things that are affecting youth. Social media exposure, academic expectations, and the lingering effects of the pandemic are all factors that relate to this intenseness and this constant pressures that previous generations didn't have. And now teens are feeling more disconnected and overwhelmed, and this can lead to things like anxiety, depression, and low self-esteem.
Yeah, so you mentioned social media. Just talk more about how much of a role that can play in anxiety and depression.
Yeah, so social media, it tends to have this nonstop comparison. So teens are measuring their lives against people who have filtered and, curated lives that they present on social media. So this can make someone have self-doubt about themselves or always tending to compare themselves to others and put extreme amount of pressures on looking good, feeling good, having that physical health and that overall mental well-being.
hmm What can parents do right now to support their children's mental health?
It's important for you to have conversations with your children and that they understand that they are in a safe space. It's easier for teens and children to listen when they feel like they are being heard rather than being lectured to. So make sure that you have discussions with them, but let them know that that they can come to you with the things that are bothering them, but also let them know that you are there to be supportive and that you are there for their own good and for their benefit.
hmm And when should a parent consider, seeking professional help for their teen?
If you notice that things aren't the way they have been in the past, say for instance, your teen or child's sleep becomes impaired or their appetite changes, you notice that they're gaining weight or they're losing weight or they're not doing the things that they enjoy. Also, if they're isolating or if they have discussions or you hear them talking about not wanting to be here, these are imminent things that you want to make sure that a healthcare professional is addressing.
And Dr. Dennis, you mentioned, having that discussion. Let's go back to that a little bit. Can you just give some more, tips and ways on how parents can get that conversation going?
Absolutely. When you see that your child is struggling, make sure that you tell them that you are a safe person that you can have a conversation with. Also, trying to do things and making sure that you have daily routines down. So make sure that you are doing things with them, make sure that you have discussions and times that you all are spending time together. So this could be things like when you have dinner together or when you are planning outings, doing sports activities, but doing things that interest them is an easy way to open the door to have a conversation.
Okay, Dr. Dennis, thank you so much. Anything else that you want to share that I missed?
Absolutely. If you or a loved one are struggling, make sure that you reach out for help. Priority Health has our behavioral health team available 24 hours a day, 7 days a week. That number is on the back of all member cards. And you can always either dial 988 or you can go online to 988crisis.com in order for you to have immediate help 24 hours a day, 7 days a week.
Yeah. All right, Dr. Dennis with Priority Health, thank you so much for your time. I appreciate it.
All right. Thanks for having me.